Next, we have Laura Zabel with Springboard for the Arts.
Hi, I'm Laura Zabel from Springboard for the Arts, and I just want to thank SVP for this incredible opportunity and say how completely honored I am to be in the company of these amazing organizations that are doing great work. Now I want to introduce you to some real live Springboard clients. This is Scott. He's a self-employed graphic designer, and because of the economy, his business has dropped way off. Because he's self-employed, he can't get unemployment, and he can't afford his health insurance anymore. He was paying $350 a month for a policy with a $10,000 deductible. He's scared to go to the doctor, but he needs medication for his high blood pressure. This is Beatrix. She's unemployed. She's 2. Her mom is the managing director of a small theater company that can't afford to provide benefits. Beatrix was born with a small heart condition, and her parents can't get her covered anywhere. I'm sure you all have stories like this. We all do. There are 47 million uninsured people in this country right now, and millions more that are underinsured, which means they lack access to the health care that they need. So what the heck does that have to do with a small organization in Minnesota whose staff is made up of 7 artists? 47 million uninsured. 7 artists. This is the story of how 7 artists decided to take on one of the biggest, angriest, most complicated problems facing our country. We knew from the beginning that we weren't going to be able to fix it for all 47 million people. Our mission is to serve artists in the upper Midwest, but even that is a pretty daunting problem. In 2007, we did a statewide research study that showed that artists in Minnesota are twice as likely to lack health insurance as the rest of the population, and a huge percentage of the rest of them are underinsured. So 15,000 un- and underinsured artists in Minnesota, 7 artists. We know this is because of the rate of high self-employment plus low income in the artist population. So it's still a very daunting problem, but our mission is to help artists make a living and a life. And lack of access to health care was consistently identified as one of the biggest barriers, so we knew that we needed to tackle it. We set about trying to understand the problem and learn the system. And we quickly realized that in addition to the very real financial barriers, there is also a huge system navigation barrier for individual artists and other self-employed people, many of whom have no idea where to even start. So we've tried being artists. We decided to apply the creative process to this daunting problem, and we quickly realized we had a very early and important realization, and that was that we weren't actually going to be able to do much about health insurance, but we could do something about health care. Oh, it's about health care, not health insurance. So using the creative process, we developed partnerships and we learned the system. We learned the system so well that last year when a writer called Nikki, this is Nikki, she's on our staff, she's a painter, a writer called her and told her what they really needed was a colonoscopy. In about 24 hours, Nikki had found him a low-cost colonoscopy. It was a temporary research program, which is another challenge of healthcare, is that these solutions are often temporary and it's always a moving target. We also knew that we had to keep things simple. We couldn't add another bureaucracy to the system. So we built a voucher program with a neighborhood involvement program community clinic. You're an artist, you need to go to the doctor, you or someone or your family needs to go to the doctor. You fill out a 1-page application and later that same day, we send you a voucher to go to the doctor. It's that simple. 200 artists have used the voucher so far. It's about health care, not health insurance. We published a health care guide that helps artists navigate the system and has common definitions and resources for both insurance and health care. It's been downloaded over 1,000 times. We've held 3 health fairs for artists that have workshops and screenings, flu shots, other kinds of information, and representatives from insurance brokers to health insurance companies, community clinics, and alternative care practitioners. Another 1,000 artists came to those. We've had 2 flu shot days and 2 free screening days. Another 200 artists were served. And our emergency relief fund has helped over 100 artists pay off a medical debt so that they can get back to their work. So we're starting to make some progress. And then came Dr. Sam. This is Sam. He's a musician and a painter and a physician, and he's also an amazing person. Dr. Sam first came to Springboard as an artist for help with a gallery that he was running, and we talked about his work, we talked about our work, and the problems that were facing the artist community, and 6 months later, he called to tell me he was quitting his job. I want to start a clinic, he said. Dr. Sam did the research, he built a network of providers that he could refer to, and he designed a new model. And last fall, his innovative, one-of-a-kind clinic opened in Northeast Minneapolis. Thanks. It's a low-cost membership model clinic, so you pay a small monthly fee and a small per-visit fee, or you can simply pay per visit. But beyond the very important financial accessibility that Sam provides, perhaps even more important is the way he's changing the patient-physician relationship and providing high-quality care to underserved communities. Dr. Sam is not your average physician. He greets people from his desk by the door. He checks in with patients he's seen that day or that week. He frequently gives out his cell phone. He's not here right now because he's seeing a patient. And sometimes he even trades healthcare for artwork. The lobby of his clinic is also an art gallery, which gives artists a comfortable place to show their work and patients a safe place to express their concerns and develop a relationship with their doctor. Last fall, we partnered with Dr. Sam on an H1N1 flu shot clinic that turned into a community-wide event. Artists stayed way past their 15-minute waiting time, chatting and networking and even collaborating on a large-scale drawing. That's just who he is. Dr. Sam didn't wait around for large-scale national systemic change. He decided to look around his own community and he decided he could fix something. It's about health care, not health insurance. So now we're 7 artists plus 1 doctor. And together, we've helped over 2,000 individual artists and their families access high-quality medical care, including Scott and Beatrix. I'm really, really proud of that. And the best part is that it's infectious. Last year, a group of artists in Duluth found a clinic to partner with, and with our help, they duplicated the voucher program for artists in their own community. And this year, with a national grant from Leveraging Investments in Creativity, we're writing healthcare guides for our surrounding states and serving as a catalyst for clinic partnerships in Iowa, Wisconsin, and North Dakota. Because of the simplicity of the models and the focus on health care, these ideas are highly replicable, and we're sharing the ideas widely and helping people duplicate them to serve the people in their own community. But beyond even the actual replication of the programs, I think there is a huge opportunity for replication through inspiration. The idea that 7 artists or 1 doctor can look around their community and decide to change something, especially something as huge and daunting as healthcare, is incredibly exciting to me. The idea that you can look around your own community and figure out who are the people that you care about and what are the skills you bring to the table, and you can fix it for 10 people or 100 people or 1,000 people or even 47 million people. That's what really gets me excited. I'm really fond of saying that I know more about healthcare with my arts background than I ever cared to. And that is true. But I've also found a passion for creative, grassroots solutions and a deep belief that we all have the power to change our communities. Thank you.